Good morning to everyone. I am going to talk a few of my innovations. In fact, it's a lot, but a few. That's diathermy round knife, which I have made, and some micro-chisels for endoscopic ear surgery. First of all, thanks to Dr. Rajiv Pachuri and the ISOCON organizing committee for being faculty here. These are all my mentors under whom I worked for 8 years. And of course, the first person who taught me tympanoplasty is Dr. Garanathan, who is also sitting in the crowd. About me, that's my website. This is some of my achievements. These are all yellow stars are where I have been faculty or operating faculty or guest lecturer, everything. So, okay, single-handed or two-handed. People like Mubarakan, they use when there is bleeding and everything, mostly use the microscope or endofolders, so two-hand they use. But I am basically a single-handed man, but if it bleeds or when it needs drilling, I give the endoscope to the beautiful nurse to hold, and I use my two hands. That's my innovation. Okay, this is a small video. One of the nightmare in single-handed endoscopic knife. Mainly this case is being shown how to manage when there is excessive bleeding while elevating the tympanomeatal flap with stapes surgery. Bleed under local anesthesia. So this is the biggest nightmare. To avoid this, I have made this Dr. Ahilas's diathermy round knife, which is a Rosen knife with an attachment of monopolar. The idea came once when I had a bleeding, I was using a Rosen's knife. I used the monopolar knife to touch on the back of it. Then I made this idea and made it. Okay, I'll play just a small video. The usual elevation, endoscopic. See, this is the diathermy knife. You keep it at the lowest level in the diathermy machine and make incision with the knife. And you start elevating. Hardly any bleeding. I use it for all my tympanoplasties as well as stapes surgeries. Much time? 7 minutes. So there are a lot of papers similar to this, but this is I have published this paper in Indian Journal, and this is now a patented product, and this is available with the surgicals outside. It's a lot of bigger presentation, but because of lack of time, I'm just skipping all these things. This is a paper which I have published, and now this instrument is quite popular among a lot of endoscopic ear surgeons. Reference. So, game changer in endoscopic ear surgery, clean incision and bloodless field to operate several other applications like septoplasty incision also you can use it. Only small disadvantage is the healing in that area is a bit slow and it takes time. The next is the drilling. You can use drill, Cusha or anything. But now I have innovated 1 mm, 2 mm micro chisel for endoscopic ear surgery because these are the one because with single hand when you drill, when you irrigate it floods, or if you don't irrigate the dust flies, bone is dust. So this is an easy thing. I will show a couple of videos. This is endoscopic stapedectomy. I am Dr. Ahilasamy from Chennai. I am going to show endoscopic ear surgery. This is a chisel. You can use curette, but it is a little slow process. I want to show that. But when you use the chisel, you can take as a chunk of bone. But you have to be very careful. You should not, your hand should not slip. You ask your assisting nurse or assistant doctor to gently tap it. So with one tap itself, you will get enough space to do a good stapediectomy surgery. Moreover, if something, you can keep the bone after surgery, replace it and fill that area also. That's the one big advantage. Like that, for tumors also I use this. This is a case of glomus tympanicum. It's a little bit longer video. I am using my diathermy knife for the incision and everything. This is okay. Yeah, I am using the, it has a quite a bigger glomus tumor extended into the attic antrum area, so I am using the chisel. It's a very faster way of doing, and you avoid the bony dust flying when doing with a single hand. And sometimes when you use a drill, it injures the shaft of the handpiece injures the canal skin. That is also avoided. And you can use it for cholesteatoma surgery. See how much bone you can use, and you can repeatedly do, and it is very faster way also. Then you take out all the bones. This is a mastectomy. Again, using my diathermy knife for the incision. See the bone being chiseled with the small chisel. In fact, I have a lot of these full videos in YouTube. I have 458 YouTube videos. You can go and watch it, especially because it's a very short presentation. I can't show it all in full. And alternately, you use the curettes also to take the bone. So much of bone has been removed. And again, repeatedly using the chisel to take more and more bone. And it is a faster way, and a big cavity has been created, you can see. So, this is a slide, I have 1 minute more, okay. This is a slide taken from Dr. Reddy. All truths passes through 3 stages. First, it is ridiculed. Second, it is widely opposed. Third, it is accepted as being self-evident. Okay, you can, this may take if some youngsters are there, they can take a photo of this. You can watch all my YouTube videos in the name of Ahilasamy, and anytime you can contact me on this number. This is my website, this is my YouTube channel. Thank you.
Thank you, sir. Thank you so much. Any questions? Okay, we have one question.
Sir, this chisel and hammer is a very old concept. Even before drill came, earlier corticals.
Very old concept, you mean?
Yeah, instrument.
Yes. So, but this 1 mm is previously not available. 1 mm, 2 mm. From 3 mm, but for endoscopic, I designed.
Sir, so what was the inventive point in the patenting process?
Pardon me?
If it is patented, then there has to be an innovative and inventive point. So what was the, is it like some curve is there or some?
It's not curved, but you have to be very careful, don't allow it to slip.
Okay, sir.
Thank you. Sir, I would request you to stay there as we'll be felicitating our speakers. I would like to call upon stage our chairpersons. Kindly. These mementos are just for pictorial purposes. You will be provided your memento at the counter where kit is being provided. We can have a group photograph just to save some time. Because fortunately we are running on schedule as of now. So, Dr. Bhavin Parekh, sir. No. Dr. Ravi Rajan, sir. Dr. Bhavin Parekh, sir. And I would request my chairpersons to stay there as we'll also felicitate you. I would like to call upon stage Dr. Hemchandra Kumar Joshi, sir, to kindly felicitate our chairpersons. Thank you, sir.